5-year-old Boya is among the close to 600 people suffering from malaria in North Horr sub-county. According to his grandmother, the boy has been ill for the last 1 week but was brought to this medical center just 2 days ago. It is a very sorry state of affairs here in Dukana ward, the epicenter of the severe malaria outbreak that has so far claimed 23 lives and over 500 others testing positive. This 4-year-old boy is struggling to sit up. His mother says he has been sick for 2 weeks. His baby sister is just 2 months old and she too has malaria. According to medics, patients have been reluctant to visit health centers close to them because of their annual cultural festival that is ongoing, where no Gabra is expected to spend a night outside their homesteads.
So the guys who are affected are those who are living in settlement camps with the livestock. Those camps are about tens to hundreds of kilometers away from the main homestead.
I brought here 11 patients and 7 others are still at home.
This 11-year-old boy and his 15-year-old brother are Bonaya Mamo's children, and they are all infected with malaria. The father says their condition is worsening by the day.
We've taken some measures in future so that we will ease this burden of health crisis in the county. As a starting point, I have already allocated Kenya shilling 60 million in our budget so that 10,000 people across the county will benefit from NHIF card, and this card will take care of the family.
Some patients such as this man are in critical condition. Some can hardly walk or stand on their feet. Others, such as this one, are suffering from cerebral malaria. She can no longer recognize her own child, and she moves from one hospital bed to another. This patient here spent her night on this cow skin because of lack of enough facilities in the wards.
Facility that you see is already overwhelmed. There are no equipment, there are no beds, there are no drugs, there's nothing. Communities, because of the cultural backgrounds, because of also this particular season celebrations and stuff, are like very rigid, not intending to come to the hospital.
However, through the national and county governments and the Kenya Red Cross, some medical personnel, anti-malaria drugs and mosquito nets have been donated to affected families to curb the situation.
It looks like this is the time that they have to be on high alert of malaria. One, because of the recent rains that we have experienced from July. 2, because of the health worker strike, specifically the nurses strike. So this has actually disrupted health service provision in most of these rural facilities.
Safi, Godana Mamo, NTV, Dukana, Marsabit.